Hey guys, Dr. Mike Monteleone here, and I want to share with you about lower back pain. When I was 15, 16 years old, I injured my lower back with an incident in the gym. It was actually during basketball tryouts, and we were doing weightlifting. And of course, when you're 15, 16 years old, you're not paying attention as well as you need to. I wasn't trained or taught on how to lift properly. And I was doing a squatting exercise, and I know when I came up, I felt something in my lower back. I felt a popping sensation and pain, and it certainly didn't feel right. And later that evening, when I was home, I could feel my lower back tighten and get very uncomfortable. By the next day, my lower back was in full spasm, and it was horrific pain. And I was unable to even play that season in basketball because of my lower back. I ended up herniating 2 discs in my lower back, and through chiropractic care helped me get back on my feet and continue to heal. And now as I'm a chiropractor today, I certainly know how debilitating and horrible it is to have lower back pain to the point where it keeps you out of doing the things that you love to in your life. And if that's you and you're watching this, then you know what I'm talking about. Lower back pain is the second leading cause of patients going to a hospital behind childbirth. And it's one of the leading causes for people to go to different doctors or physicians. It's a big deal. Majority of people will experience lower back pain in their lifetime, and 30% of the population is experiencing lower back pain right now. So what do we do about it? Right? So if you go to a medical doctor, more often than not, they may do imaging, they may look for pathology, which is obviously good. They may recommend injections, medications, maybe some sort of therapy. All right, when people come to our office, what's different than the medical office is we want to understand why you're experiencing the pain you are. Number one, we want to help you feel better. We want to get your life back on track and allow you to not have to worry about your lower back. But the most important thing, more important than feeling better temporarily, is to understand the cause of the issue and to increase your body's function and really get to the cause of the issue, right? And that's a bigger deal. Unlike masking it with medication or an injection, we're going to look at your diagnostics, such as your X-ray, such as thermography, to really evaluate what is happening. Are there underlying issues we need to address? So when we look at the human spine, your spine stacks up like this. You have your cervical, which is in the neck, your thoracic spine, and your lumbar spine, right? That's what builds your vertebrae. And there's 5 vertebrae called your lumbars that make up the lower back, and that sits on your pelvis. So we have our sacrum, our tailbone, and our coccyx, and then we have our iliums, which make up the pelvic complex. All the weight of the body settles on the lower back. Think about the amount of stress we put on our lower back every single day. You may work a job where you have to sit a lot, right? If that's you, the body was never designed to sit. What's the problem? It puts an immense amount of pressure. It's the most unnatural position and compromising position for the lower back. It essentially creates a lot of pressure in the lower back that will ultimately, in many people, create problems such as arthritis, such as disc issues. So sitting is a major problem. What about standing and driving and lifting or manual jobs, right? Again, the lower back. If the spine gets put out of proper alignment, which we call in science a subluxation, so if the vertebrae shift out of proper position, that will create degeneration, altered mechanics of your body, and essentially your lower back will degenerate. It will break down, which also known as spinal arthritis. This poster behind us shows the different phases of degeneration in the spinal column, specifically the lower back. And as you see up top here, this is a normal healthy disc, normal healthy vertebrae, and this is from the top, normal healthy disc. When the spine shifts out of place, now let's discuss this. How does the spine shift out of place, right? Well, stress, You would agree, we all go through different stressors. I mentioned sitting and standing or lifting, but think about as a kid, as a baby, right? Learning to walk, maybe sporting injuries like I have gone through, like you most likely have gone through. What about slips and trips and car accidents? It makes sense. If these bones shift out of position, they're not gonna move as well. It's gonna create inflammation and it's gonna put abnormal load on the joint. And what we see is when the spine shifts out of place or subluxates, what happens is the disc becomes weaker. The body's demanding more work from that disc and those joints, and the disc will actually begin to crack and fissure. It'll break these outer fibers. And again, it's a snowball effect. The disc can actually bulge and create pressure. Just as you see these discs in the spine, they can actually push out. That can put pressure on the actual nerves. And then eventually, because those discs are being worked harder and harder and harder, they will actually thin. So when we look at some of these x-rays and see that these discs are stressed out to the point where the discs thin, that means that you've had this problem going on for years and years and years. It takes a long time for your x-rays to actually show thinning of discs. And then the later phase is when we actually see bone spurring appearing. So bone spurs are your body's response to a stress. Bone's the strongest thing that your body can create. So when it senses an injury or a problem or a subluxation, a misalignment, your body's, by design, intelligent design, will try to shore it up. It will try to splint it, if you will. And eventually it'll fuse the lower back, okay? So with all that said, what do we do? What approach do we have in our office? Number one, we help a lot of people with lower back issues, all right, every single day. Number one is we learn about you. When you come in, we sit down and go through your history. We want to know about things that you have gone through in your life, in your body, that could possibly be causing what you're feeling today if you do have lower back pain. Number two, and most importantly, before we do any sort of adjustments in our office, we want to do tests. We don't take guesses, we do tests. We evaluate using diagnostic x-rays, as I mentioned, when needed. That will look at the clinical anatomy of your spine, the health of your spine. And then we also do a test called a thermography. So it's a scanning technology that will look at inflammation that will be produced on the nerve level when there's a misalignment or subluxation. We take that information as doctors and evaluate it and come up with a customized game plan to help get the problem resolved. And through a series of specific spinal adjustments, our goal is to restore movement and alignment to the lower back, to the pelvis, and the rest of the spine for that matter. We focus on the entire body, not just where you feel pain. Everything is connected. Okay, so with that being said, everybody is a unique individual, but what we find to be true is when we restore motion, alignment, and better posture in the human spine and pelvis, you're going to be able to move more freely. There's going to be less inflammation, less tension on your soft tissues, the muscles and ligaments. As your lower back begins to move more freely, it's going to calm down the pain, allow you to function, and your body will be given what it needs to heal. Don't be deceived by quick fixes. One of my mottos is a quick fix is a no fix. Our goal is to really get to the underlying issue. In the beginning of care, the first 2 to 3 months, we often will see the patient at a higher frequency so we can retrain your body, if you will. We'll show you in some other videos on this website what a specific chiropractic adjustment looks like for the lower back. Again, guys, I'm Dr. Mike Monteleone. We look forward to seeing how we can help you and serve you with a different perspective, a natural hands-on approach to allow your body to function the way that it was designed to.